Alright guys, so in the pathogenesis of complications of diabetes mellitus, there are steps before the complications come up, like all those diabetic retinopathy, diabetic neuropathy, and all those diabetic stuffs. So one of these steps, or the last step, is what is known as what? Hexosamine pathway and generation of fructose-6-phosphate as a cause of what? Diabetes mellitus complications, rather. Right? That complications is supposed to be there, very important. So for the hexosamine pathway, right, we said that hexosamine pathway plays a crucial role in glucose metabolism and has an implication in the development of insulin resistance and also diabetes mellitus, particularly the complication. So the pathway is what? A minor branch of glycolysis where fructose-6-phosphate is converted to what? Glucosamine 6-phosphate. And the enzyme that is needed here is what is known as fructose-6-phosphate amidotransferase. You see this? Okay? Fructose-6-phosphate to glucosamine 6-phosphate. So mechanism linking this to diabetes is the increased influx of what? Increased flux through the hexosamine biosynthesis pathway. Excess glucose is what? Diverted to the hexosamine pathway, leading to increased production of what? UDP-N-Acetylglucosamine. So the UDP-Acetylglucosamine is involved in it's a glucosamylation. Okay, so that's like a post-translational modification that affects insulin signaling. Then insulin resistant development. Once this is elevated, it disrupts insulin receptor signaling. So this will now impair glucose uptake in muscles and adipose tissues. So increase this now, increase expression due to fatty acid metabolism. So further, it will now enhance insulin resistance. So diabetic complications now. Now, if there is chronic activation of the hexosamine pathway, it contributes to vascular damage, cardiomyocyte dysfunction. As the muscles of the heart are getting dysfunction, Inflammation, it also plays a role in diabetic neuropathy, diabetic nephropathy, diabetic retinopathy by altering the metabolic pathways. So clinical significance is targeting this has been explored as a potential therapeutic strategy just to deal with insulin resistance in diabetes mellitus. So dietary and pharmacological interventions that reduce hexosamine pathway activation will help to prevent the various complications we have in diabetes mellitus. So this is just a summary of it. So flux of glycolytic intermediates through the hexosamine pathway leads to increased oxidative stress. Those are the reactive oxygen species, and there's like damage to the cells and all of that.